Welcome, everyone, to our February webinar. I'm Lynn Kinst. I'm the Executive Director of the Hemophilia Council of California. And tonight we are going to talk about how to advocate for yourself as a patient. I just want to give a quick introduction to the Hemophilia Council of California if you are new to our webinar series. We are a patient advocacy organization that's focused on access to care and education and advocacy for people in the bleeding disorder and broader rare disease communities, and are really here to help support you on your patient journey as you seek to ensure that you have the most excellent care available. And our mission is in line with that, improving access to care and treatment options, advancing the quality of life for people with bleeding disorders, along with our others in the rare disease community. All right, so with that, I want to jump into our topic for this evening, which is really how to advocate for yourself as a patient. And typically at this time of year, we like to do a webinar on, how to tell your story. And we put that in the context of telling your story to a lawmaker or a policymaker, somebody who's able to affect change, right? And something that we all want to develop that skill and be able to advocate for ourselves and our community. But that's not the only place in which we need to be able to tell our story and advocate for ourselves, right? There's a lot of ways in which we have to speak up. It might be in the doctor's office, it might be with our insurance company, or maybe we have to go to the emergency room. Maybe it's in our workplace or at our school, right? And so tonight we're going to focus a little bit more narrowly on how to be an advocate for yourself in a medical setting, but we're also going to then at the end touch on how that translates over into advocating for ourselves in some of these other environments. So with that, I want to introduce our other speaker who's joining us this evening. Dr. Hilda Ding is a hematologist at Rady Children's, and is the lead hematologist in their hemophilia treatment and hemophilia and thrombosis center there at Rady's Children. And she attended medical school at State University of New York and went to Stony Brook University School of Medicine. And she's going to join us this evening and talk a little bit from her perspective about what information is it that we can provide as patients and caregivers to our doctor that's going to help them provide the best care for us. So I think we'll maybe start with that question, Dr. Ding, and then we can kind of continue the dialogue on some different topics here.
Yeah, absolutely. Hi, everyone. I'm so pleased to see all of you here today, and thank you, Lynn, for inviting me to be part of this. I think with regards to the first questions, I think it also, depending on which provider, right? I think from the patient standpoint, you obviously have your hematologist, but I think in the space of these rare blood disorders, also in the ER, right, and your primary care, and if at your dentist and your surgeon if there was a procedure needed. So I think in these different settings, there's going to be different ways that could be helpful in advocating for yourself. Obviously, if you're at your hematologist, they know plenty about your bleeding disorder, but it is still really important from my standpoint to know what is working for you, what is not working for you, and how you would envision your life if it's sort of like your wish list. I am trying hard to change the stereotype to let young patients know, as since I'm a pediatric hematologist, that I want them to paint me a picture of how they envision their lives to be and what we can do to try to um, facilitate that, in ways, whether it's are you bleeding on the current factor regimen? You're not bleeding. Are there certain activities that you would like to do? I think the biggest thing for me is don't be afraid to ask. I find patients like always afraid to ask. The answer isn't always gonna be no, right? Um, and I really think most of the time, there are things we can work with. I have young men who want to play baseball, softball, soccer, and I say, okay, I don't love all that, but I love that you want to stay healthy, active. How could we modify your factor regimen during the training season to protect you from bleeding? So, on that side of things, bleeding logs are important, being compliant with your medications. Um, and as our young folks get older and older to transition, I really, really find it what helps the transition to adult hematology easiest is when the patients at a young age, usually we try to start around 14, 15, learn their disorder. What factor deficiency do you have? What is your insurance? What is your home care company? Every year we try to have them learn a little bit by a little bit. Depending on where you are, the transition could be at 18, could be at 21. But even at centers that are lifespan centers, right? At some point, um, whether it's 18 or 21, the patient themselves are going to have to start making the call themselves. So I think these are things that, from my standpoint, I feel uh, could empower you in this transition. The other issue I find most often in this transition that we cannot help with is to make sure you transition at a timely fashion so your CCS doesn't lapse and there's no transition to the GHPP. That is really the only issue from a pediatric center standpoint that is really hard for us to help. You really have to transition in a timely manner to your adult center for that to go over. Um, and well, Lynn, should we move forward to the support in telling your story?
Yeah, well, I think one a question I was going to throw in there is, so we talked a bit little bit you talked a little bit about how what patients can communicate to
Yep,
you. And kind of along that same vein, is is there a like how is it best for them to communicate? Like, we have these electronic health
absolutely.
systems now. um is that kind of individual doctor to doctor, whether they prefer that patients put stuff in their, in their health record, or whether they call the center,
Yeah.
that type of thing. Advice would you give to patients on that?
I do think there's some degree of what each individual center prefers, but I think it's pretty true across the board. If you're bleeding right now, you are in the ER, I think that a phone call is always the quickest. While there is my chart and these ways to communicate, those are not checked as frequently as if the phone rings. So I think the other ways to communicate, like my chart, is more appropriate if there is not an ongoing urgent medical issue going on. For example, um, they need a refill of my factor running out in a week or two. That can easily be a my chart message. Or I need my wisdom tooth extracted and it's scheduled like 2 weeks from now. That totally can be an electronic message. So any non-urgent questions, but definitely if you're bleeding or you're in the emergency room, you've had an accident, that definitely needs to be a phone call. And I think most centers, just like ours, there's one of us on call 24/7 that the operator can connect you to. So that's always a phone call, even if it's after hours. I think most centers are pretty similar. They have very experienced nursing case manager that man the phones. And, if you call and they don't pick up, it's probably because they're speaking to another family, another parent, another patient. Leave a message so we know you called, and most centers I know will get back to you in a timely fashion if within an hour or two, definitely by the same day. So,
Perfect. That's great. And then along that same lines, we mentioned, like you're actively bleeding or you're going to the emergency room as a hematologist
yeah.
who's treating, bleeding disorders patients. What do you hope that patients are communicating to the emergency room? I think most patients have had
Yeah.
experience with emergency rooms where, obviously hemophilia, VWD, rare factor deficiencies, other rare diseases, those are not the things that ER physicians and staff are dealing with every day. So what can we communicate to make that whole process go smoother.
Yeah, so I absolutely agree with you, Lynn, and these frustrations are also amongst the doctors ourselves. So, um, you are not alone. I, it shouldn't be, it should not be on the patients, but I urge everyone, if you feel that no one is listening to you, no one believes your bleeding disorder, which is quite unjust and not fair, you can insist that they call your hematologist. If they don't call, you call us and say, hey, and that's what I've told families, especially in the recent years, we are diagnosing women with hemophilia as well who bleed with low levels. We are working hard to educate the rest of the medical community that it is not just a disease that men and boys get. But I still hear frequently from my female patients that no, I get told that it's not possible because I'm a woman, I'm a girl. So push back, say this is a thing, and our center gives patient an emergency wallet card. So that is where all the information is. And if you forget it, there isn't one, really insist that they call your hematologist, and in situations that you have told them they haven't called, you call the on-call number yourself and say, hey, this is where I am. This is the number. I feel that they're not listening to me. Can you make a call? Our division, our doctors have certainly reached out and done that for our patients. I would say that is few and far between. However, it is unfortunate when it happens, especially I find it happening mostly in outlying centers where they don't see a lot of patients like ours, that you would need to insist on yourself. The other thing is the wallet card we give to families. I also, for the young patients, right, our teenagers, where the parents are keeping the card, I ask the teenagers, you need to take a picture of that card and keep it on your phone, right? Maybe that's a good idea for everyone. I do that for everything on my phone. So if I take a different bag or I'm just in the middle of something, I can always show my phone.
Yep.
Um, yeah,
I have a couple of little tidbits that I'm going to add to that and just say
absolutely.
one is, when you tell them or when you talk to them in an emergency room setting, hey, I need you to call my hematologist, make sure that they're actually calling your hematologist and not just the hematologist that is on call for the emergency room, because that hematologist may not have expertise in bleeding disorders specifically. So make it clear to them, provide them with the name of your physician and the contact information of your center and ask them to call them. And then, like Dr. Ding said, do not be afraid to make that call yourself as well. Or have if you have a family member or a friend that's with you that can call for you and say, hey, this is where we're at this particular hospital, etc. And then on the little tidbit to say, like, hey, if your center has not provided you with some kind of wallet card or instruction page, definitely that's something you could ask your provider for, to see if your hematologist and your team can provide that for you. And my little trick that I have done with things like insurance cards for myself and my kids, I've taken those photos myself, have them on the phone, and then you favorite the picture. You put the little favorite on the picture, and then it's in a different folder. So it's easy to find. So it's not like, you did that 2 years ago and it's in so far back in your photos that you can't find it.
Yeah,
So
it's like for me, it's going to be buried in the thousands of pictures of my dogs. So,
exactly. So that's my little trick on taking the picture of that information. And I think in particular for our teens, that's a really good option, right? Because you're like, oh, I don't want to give them the card because they're going to lose it. Well, maybe, but they do definitely need to have that information handy. If they're not with their parent when something happens. And then, how many teenagers are apart from their phones, right? They're usually going to have that phone on them.
and
Uh,
I think the other thing is also if, the situation allows, you're bringing your factor with you. Sometimes I find, could be another way to show, no, yes, this is my factor. Someone prescribed this to me. It's a real thing. That certainly sometimes get their attention too, but I do realize sometimes there is not time to run home and get your factor. So
Yeah, absolutely. There was a good comment in the chat. They said you can also search your name in your camera roll if you did not favorite your photo and you can't find it, which I had never thought about doing it that way, but there you go, because your name will be on your card. So
And I think along those lines, and especially, we also have our interpreter on the line. You are entitled to interpreter services. So if you do not feel comfortable, ask for it. Like you're entitled to that, and you need to be able to understand, what is being told to you, but also have the provider fully listen and understand what you're trying to convey to them. And, you know, along that, also be mindful that your care is not does not change based on your immigration status. So please, if you need help, you have concerns, um, reach out to your center. We will do everything in our power to help you.
absolutely. I think these are important times to remind people of that your hemophilia treatment center is a safe place to receive care, that your providers want to help you. And if you have concerns, please just don't go dark, but contact them and let them see what they can do to help you feel comfortable receiving the care that you need. So appreciate that reminder. Um, is there anything you wanted to add in terms of like what people can do to like illustrate or share examples that really help you understand better how a patient might be bleeding, how they might be feeling, kind of what's going on? Any other tips that you can suggest?
I think details are important. Where's the pain? How long have you bled? And, when I talk about menstrual cycles with my female patients, I want to know how many days are you bleeding? How many pads, tampons, cups are you filling? And I think I'm finding that we don't really have a good handle, and we have not done a good job educating our female patients about what is normal, what isn't normal from a menstrual cycle standpoint. So, and just sort of moving away from the stigma, right? So I will say, this is what's considered normal. This is what's considered heavy. Um, this happens to half of the world's population. We need to be talking about it. So
Absolutely.
details, logs, is important, and especially if it's an injury, the mechanism of injury also helps us triage whether, gosh, you better come in the emergency room, or could it wait, when the center opens in the morning, or we fit you in sometime, in the next day or two. I
Yep.
also think that benefits the patients in a way. I have not heard anyone that loves going to the ER.
Yes, we
Yep.
used to get very frustrated with my dad because he would put it off and put it off, and then inevitably it felt like it always ended up being the middle of the night that he couldn't stand it anymore, and he would end up at the ER. So, if you can
Absolutely. I also want
consult
you
with your
all to know,
doctor earlier,
yeah,
that's good.
I also want you guys to know we also don't like it when our patients have to end up in the ER. So we really, I think our cross centers try to do what we can, to be the ones to see you in our center.
Excellent.
So
Well, that
definitely the quicker you stop bleeding, the less likely you're gonna need to go to the ER.
yeah. So kind of the flip side of that, is there anything that you kind of hear from patients, or maybe this is more about kind of like feedback you get from other physicians sometimes, but is there things that patients and caregivers do that maybe make it harder for you to hear their stories? I mean, I know you on a personal level, we've chatted, and I know you're trying to really just listen to your patients and hear them, but do you think that there are things that patients maybe do sometimes that make it create barriers between that in that relationship with their physician?
Yeah, I think sometimes, especially as the young folks transition, um, we really would like to start hearing more from our young patients, our teenagers who are getting ready to transition. Not just in a way to make sure they understand their disorder, but I also want to understand what they're feeling, where they're coming from, sort of how they envision their health, their life being. Um, and I think it is hard for me too to transition them. It is hard for me to kind of not meddle too much too, but I think I have to realize, and I think sometimes parents, families also need to realize if we um, it's a fine line between supporting, advocating for our young patients and kind of enabling them not to take charge of their own health. I have seen quite a few times where the moment transition comes, um, caregiver calls the center and the person they get on the other line is like, nope, I really can't talk to you. I need to talk to the patient themselves. And so, and then that really is not fair and it's hard and it's very stressful for the patient who all of a sudden instead of having years to learn, a little bit at a time, this the name of my bleeding disorder. This is the name of my factor. When do I use it? What is my insurance? Who's my doctor? What's my home care? Who do I call? Like all of a sudden, instead of having years prior to transition to learn, all of a sudden the clock changes and they have to learn all that. And I think that's actually a lot harder and more stressful. And they have not had the opportunity to practice advocating for themselves with the safety net of their families and parents like nearby, like to phone a friend, like when it's still okay. So I really love this model where like, hey, they're just your phone a friend, you pretend they're not there, and why are you here today? Tell me, who's your home care company. So,
Excellent. So there's a good question in the chat.
yep.
Um, kind of maybe asking you to address like if maybe there's an issue and you're not connecting well with your provider for some reason, what is a good way to ask help from another provider? Maybe another
Meaning,
provider in the center or um like the example is for example asking for
ah,
another nurse when one is trying to infuse you or your child and isn't able to do it or
so I'm imagining the situation as a difficult stick, and somebody's tried a few times and unsuccessful. That happens to the best phlebotomist. So it
yeah.
is totally within your right to say, gosh, he or she is going through a lot. Can we take a break? And then afterwards, let's take a break. Can someone else try? It is totally okay to say that. I don't think it has to be confrontational. It just has to be like, take a deep breath. Gosh, this is really hard. Can we take a break? We're not wanting to go home. We still want the infusion. We're not refusing anything. Can we take a 10-15 minute break? And can someone else try? Because I also see it is very frustrating for this nurse. So that way, I think also the provider has a way out because I'm sure, just being a provider myself, I know if I try the stick, if I try the procedure like 2, 3 times and I'm not getting it, it doesn't say anything about me as a technician. It's just today's not today. And if I keep at it, I'm going to get more frustrated. It's not going to happen. So maybe something along that line. Let's take a break. Can someone else try? Because I see you are also very frustrated. Because I'm sure they are.
Yeah, no, that's great. Other before we hop over to this other kind of point, are there
Is there a
other
Spanish
questions?
question?
No, I think that was the translation of the question
Oh, I see.
that
Sorry.
was being asked. We try to translate in the chat so that everyone knows what's being said.
And
Uh,
then maybe to add to that, if you have somebody you really like, um, that is always gets your child. There are some nurses and phlebotomists that are great like that. It never hurts to ask prior to your appointment. I'm not saying like the morning you show up, hey, is so and so here. If there's a day you're coming for blood draw or infusion, look at your appointment days, just send a message, hey, is that a day that so and so is here as well? May we have them? you know,
Yeah.
it doesn't hurt to ask. In our center, we understand our, pediatric patient, the toddlers and the babies are really hard, and there's sometimes just one or two that are really good, and we certainly try to do that. But when patients bring up, hey, we work really well with so and so, can they try if they're here? And we try definitely to honor that.
Yeah, that's a really good point. And again, always the further in
Plan,
advance
plan, plan, plan.
that you
Yes.
yeah, the further in advance that you request those things, the more likely it is for your center to be able to accommodate your request or move your appointment to a time when that provider is available. Right. And so that can be
And I don't know if this is a cross center, but I also hear from an access issue. Sometimes the ED have issues accessing patients' ports. Our little guys that still have ports for infusion.
Mhm.
Um, I know our center, again, I cannot promise our cross centers are if, our hematology nurses obviously are the ones that access ports all the time. If, the unit or the clinic isn't crazy busy, our nurses are willing to go down there and help access. And I think that's one of those scenarios where the ED nurse probably like, oh, thank God, somebody who does it can come, right?
Right.
Um, so again, never hurts to ask, hey, our heme team, gets it easier every time. Can you see if someone can come down? Or if it's during the day, you call your case manager. Hey, can you come down? Or even, hey, what inch needle have you guys been using? And what inch needle are they using to access the port down there? And then, okay, that's an important piece of information. Like if you find that your child is a difficult port access, sometimes telling other providers, hey, they're really using a 1.5 inch needle, that's the one that works for them, that could make the experience very different. Because sometimes somebody new may not actually know what size needle works for you, so they're sort of going on the size. But as we all know, the weight of the patient. But as we all know, we're all built differently anatomically, and depending on where the port is on your chest. Some patients, end up needing shorter or longer needles. So if you're a parent or a family member of someone who has a port, I would urge finding out how many, what is the size needle that you typically use for access.
That's great. Um, so we're kind of coming to the end of our time. I want to just make a couple observations and then we'll see too if anyone has any last questions. But, as we think about these other contexts in which we might be wanting to advocate, I just want to remind everyone there's kind of three main things to think about when you're wanting to tell your story, right? And I think the first thing is know what your purpose is. So, what are you trying to accomplish, right? If you're seeing your doctor, you may have specific questions that you want to get at, ask, and have answers come back to you, right? About you know whether you think your medication is working or not working well, or you think you like with a child who's growing, maybe you're needing to assess like, hey, is the dose still the right dose of this medication, or you know whatever your purpose is for that meeting, right? Consider then your audience. um are you talking to a doctor? Are you talking to your child's teacher? Are you talking to a policymaker? So you're knowing your audience is going to help you know like what information do they need in order for them to really get to that purpose that you're trying to accomplish, right? With that conversation. And then lastly, how much time do you have, right? Um, Meetings with legislators are often 15-20 minutes at the max, right? So you're trying to get a lot done. Frankly, in a lot of healthcare settings today, physicians don't often don't have much more time than that either, right? Maybe in your comprehensive visit you have more time, you're seeing multiple providers, but often in regular routine healthcare you have kind of brief windows, right? So you really want to always think about that and get kind of your most important points in up front. And it's always helpful to maybe organize your thoughts by jotting some things down. Write down the questions you want to ask your doctor or the points that you want to make in that meeting. So just a few tips to help you kind of translate that across settings.
Yeah, gonna add to that. A patient of mine actually, like, I love this idea. When she writes down the question she wants to ask, she like leaves, this is a parent that leaves some space for the answer. So when we talk about it, she writes it down and she's like, yeah, then I can go back and look at it.
Right.
And that's also sort of where she, like, details are important, keeps like sort of the bleed diary, you know.
Mhm.
So when we come and we talk about her bleeding history, she's like, yep. And then looking at it, it really helps to be efficient with the short time we have to come up with the best treatment possible.
That's awesome. Maybe like keep a notebook that's just every time you go to the doctor, that's where what you bring, and you have tracked that information at home as far as like a bleed that you had, and the details about that, and then it's all in one place. And I love the idea of leaving space for the answer, right? Because a lot of times we write down those questions, but then we're not going to always remember everything, especially if we had more than one thing that we wanted to talk to our doctor about, right? We're not necessarily going to walk away remembering all the answers if we don't write it down. So that's great. All right. Well, I'm going to kind of wrap things up here. But again, if you have a question, please raise your hand or throw it in the chat and we'll come back to that. We have a number of webinars continuing to come up. We're going to continue to have some of these conversations with some of our providers from our hemophilia treatment centers. And also, as we move into the year, later in the year, we tend to have a lot of topics related to insurance, navigating our insurance, and talking to our insurance companies. But next month, we will be talking about how to spotlight the patient voice as we prepare for Legislative Day, which will be the webinar will be on the 12th, and Legislative Day is on the 17th. And then I also want to thank our sponsors who really helped make this webinar series possible. All right. Well, thank you so much for joining us this evening. Thank you so much, Dr. Ding, for participating with us tonight and for all that great input on how to, continue to work with our physicians. And we look forward to seeing everyone at our webinar next month. And hope you all have a great evening. Thanks for joining.
Thank you, everyone. Happy to be part of this.
Good night.
Good night, everyone.